Good afternoon. Great. Fabulous. Welcome back. We're going to have a short session about health. You know, everywhere I go, people ask me, Chidi, what is the best medicine? What is the best? Just give me, what's the best pill you can take? What's the best drug I can inject just to make me feel better? So actually, last year, I was asked by this magazine, Top Santi, to talk about some strange medicines. They said, tell us about some interesting, strange medicines that we used to get years ago. So I did a lot of research, and you know what? We used to give some very strange medicines. Doctors used to do this. If you can believe this, asthma cigarettes. This is real, this is not a joke. We used to prescribe cigarettes for people who had asthma. Can you imagine that? So somebody comes in, they can hardly breathe, they're wheezing, and the doctor would prescribe them cigarettes. Didn't really work too well, I have to say. How about this then? If you have a toothache, take cocaine. You take your little child to the dentist, he's got a toothache, swelling of the mouth, and the dentist gives the child cocaine. These are real treatments that we used to give. We used to go to our trusted doctors and dentists and get this kind of treatment. What about this? Do you know what this is? Mercury. You know, in the 1800s, we used to give mercury for just about everything. If you had a little cut, we'd put mercury in it. If you had a disease, we'd just give you mercury. The good thing about mercury is that it was 100% effective. It killed every disease known to man. It also killed the man as well. 100%. You may realize that Mozart, he died from mercury poisoning. Beethoven, exactly the same way. Even Napoleon, the great General Napoleon, died from mercury poisoning because they had diseases that the doctors of the day thought, yeah, it can be treated with mercury, a poison. So the question has to be, what about today? Are there any strange things that we're giving people for diseases today? Because the truth is, when people ask me what is the best medicine, I say there's pretty much only two great medicines. The first one has to be food. Food is medicine. Food is medicine. You see, when we qualify as doctors, we're supposed to take this Hippocratic oath. The Hippocratic oath was named after Hippocrates, who's the father of modern medicine. This is what Hippocrates had to say way back when. He said, let food be your medicine, and let medicine be your food. This man was a lifestyle doctor. This was way back before all the laser surgery, antibiotics, everything. Let food be your medicine, and let medicine be your food. That is exactly the same today. I mean, let's look at things like heart disease. Look, when I was training as a surgeon, I spent several months up in Papworth. You know, there were 5 of us in the country who were privileged enough to train in surgery at Cambridge. And Papworth Hospital was connected to Cambridge, it still is. And I spent 6 months there. Wonderful surgery. Some of the greatest surgeons in the country. You can see them doing heart transplants, all sorts of wonderful things. But the majority of surgeries that we saw and that we assisted in were bypass surgeries for heart disease. And you know, that every day you do about 3 of those, and it would take hours, and there's lots of us in the room. And I always remember one day when I was in clinic, a gentleman who had had bypass surgery before came back and he said, look, I'm getting chest pain again. It was obvious that this man needed another bypass. And so my professor was sitting next to me. I was just observing. But the man was too sick to have more surgery. So the professor said, well, you know what, there's nothing we can do for you. And the gentleman said, well, if that's the case, what do I do? The professor said, well, there's nothing we can do. We let that man go. He died within about 3 months. These are some of the best surgeons in the country. There was nothing to offer. But when we're talking about the best possible medicine, I'd like to take you back to some research that was done by a man called Esselstyn Caldwell. He showed how to actually reverse heart disease. He took 18 patients. All of them had severe heart disease. And by severe heart disease means that they have chest pain, they can't walk very far without pain. He showed that in the 8 years up to this experiment, they had about 49 different cardiac events. And that could have meant, yes, a heart attack, chest pain, a stroke, something like that. All he did was change their diet to a low-fat, plant-based diet, no animal products in it at all. Within a few months, the cholesterol was halved. By the way, after 2 weeks, those people who had chest pain had no chest pain at all. You know, sometimes it can take 2 weeks to see a cardiologist. Just by changing your diet, the symptoms went away. And the interesting thing is that most of them showed a reversal of the disease. So the artery was now opening up. No surgery. Food is medicine. I mean, who would rather have their chest opened up by a load of doctors rather than just changing your diet and reversing the disease? It's amazing. It's miraculous. And even today, still, even in medical schools, we're still teaching people that heart disease cannot be reversed. We've known this for a long time. And how about this? Everybody knows about diabetes. You know, diabetes is the epidemic of the day. It's taken up about 10% of the NHS budget. Did you know that? Over 10 billion pounds every year taken up by type 2 diabetes. But we know that by restricting your diet, having less calories, you can reverse type 2 diabetes. Some people say, it's impossible to reverse type 2 diabetes. But you even would have heard, have you ever seen people who've had gastric band operations? They've been really obese before, they have a gastric band operation. If they had type 2 diabetes before, after the gastric band operation, the type 2 diabetes goes away because they can't get the same amount of calories in. Well, there's a healthier way to do it. There's a natural gastric band just by eating lower fat, lower sugar foods. That's the natural food that we eat. How about type 1 diabetes? You know, type 1 diabetes is different to type 2. It's an autoimmune problem. And that autoimmune problem is very much the same as these autoimmune problems. Addison's disease, thyroid disease. And people say, you know, well, why do people get these diseases? How does it happen? When I was at school, at medical school, there were all these wonderful, weird named diseases that were all autoimmune. And you look in the books and you say, well, what causes them? They just say nobody knows. Well, we do know what causes them. The biggest problem for type 1 diabetes and all these other autoimmune problems is that actually 90% of the time it's because at some point in our life, undigested milk protein gets into our blood, our antibodies start to attack that protein, and as they identify that protein, they start to look for other proteins that look like the undigested milk, and we have proteins in our body that look like milk. So then they start to attack us. They attack our thyroid gland, they can attack our skin, they can attack our brain, our nervous system. And people say to me, oh, well, that's nonsense. You know, this leaky gut syndrome that you talk about doesn't really exist. Well, let me prove to you how it does exist. Breastfeeding for children, is that good or bad? You're sure it's good? Why is it good? Was it good nutrients? What kind of nutrients that are very good for the child? Antibodies. Antibodies. You'll hear about that, don't you? That the mother can transmit antibodies to the child. Okay, well, let me take you back to your classroom when you used to do biology. Do you know that when you eat a protein, you have to digest it into its smallest parts? Do you know what they're called? Amino acids. So in order for you to absorb a protein, you have to digest it into little amino acids. Okay, you remember that, right? Okay, so if a child who is suckling on his mother's breast is taking in antibodies, antibodies are big proteins. How do those big proteins get into the bloodstream? Surely they should be digested, right? Into amino acids. Well, the truth is, all children have to have a little bit of a leaky gut to allow those antibodies into the bloodstream. We all have it. So those larger proteins are able to pass into the bloodstream to allow those antibodies to have their work in the blood. Okay, so we know that there is a leaky gut. As adults, we get a leaky gut when we're stressed, for example. Sometimes when you're stressed, you can actually feel your stomach churning over a little bit. So when we're stressed, when we're on certain types of drugs like antibiotics or things like ibuprofen or steroids, we get a leaky gut. And it makes a hole in that wonderful system that's supposed to protect big molecules getting through. Now, speaking of interesting ways to treat disease, Crohn's disease, ulcerative colitis, you've heard of those, right? They're quite debilitating diseases. That's where you get an inflammation in your bowels. Very difficult to treat. In fact, when I was training as a surgeon, much of my time I was assisting surgeons who were just cutting out bits of bowel that were inflamed. That's what we used to do. And if it can't join back together, we give them a colostomy bag. Not very nice, very difficult. But we know that especially Crohn's disease is an autoimmune disease. So if we can treat the autoimmune disease, if we can hold back those antibodies, we can actually reverse the disease. How do we do it? Obviously, we have to avoid the trigger factors, usually dairy. We have to give loads of vitamin D3, that boosts the immune system, and have a plant-based, low-fat diet. Those simple terms, those simple instructions can actually lead to being free of the disease. And there are lots of people, in fact there's several doctors that I know, who are now 5 years free of Crohn's disease just by changing their diet, no operations. Amazing, wonderful. Food is definitely medicine. How about cancer? Those of you who know the China study, you will know that our animal fat intake, our animal protein intake, is directly linked to the amount of cancer we have. Civilizations like Thailand at the bottom there, who have very low amounts of animal fat, have very low amounts of breast cancer. You go all the way up to places like Denmark and New Zealand, who have high amounts of animal fat, high amounts of breast cancer. You can say the same for colon cancer, prostate cancer, all the cancers really. So the more we can stay away from animal fat, well, the more we can avoid cancer. We know that 80 to 90% of known cancers are preventable. We are spending billions of dollars all over the world trying to research how can we actually get a cure for cancer when we have the means to prevent it. And prevention is always better than cure. Now obviously with food, we said it's a drug and it's good medicine, but you can overdose on food, right? Many of us can overdose on food. And I always say this to people, obesity is very, very simple, okay? You apply the laws of thermodynamics, matter cannot be created or destroyed. Obesity is just that we eat more calories than we burn up. That's all it is. If you're still eating the same rate that you ate when you were a teenager, and you're not burning up the same amount of calories, you get the middle year spread, right? You get the middle year spread. And I've just come back from America. America is absolutely signed up to making us put on weight. There are no pavements to walk on where I was. You have to be in a car. Everything is drive-through. I saw a drive-through funeral. I mean, who's in such a rush at a funeral that they need a drive-through? I don't understand that. But they've done everything for our convenience. And if you're not burning up the calories that you're eating, we put the weight on. So that's one type of medicine. The next type of medicine is, of course, exercise. Exercise, I can hear some of the groans in the audience already. Exercise, oh, that's painful. I have to sweat, I have to get changed. It's not actually that bad. There are so many benefits to exercise. So many benefits to exercise. Obviously, it will reduce the amount of fat. And you know what? I'll let you in on a secret. Just simply by standing, you're burning up twice the number of calories than you do when you're sitting. All of my meetings at work, I do when we're all standing. Actually, it makes the meetings a lot shorter, I have to say. People don't drone on as much when they're standing. They have to actually move. It increases the amount of oxygen in your body. It actually has been proved to increase our lifespan. People who move more on a daily basis live longer. And they don't just live longer, they live better. You know about Loma Linda. Now, I go there quite often, and I remember being with a woman who was, I think she was just about 100, and I was walking with her, and I asked her, you know, how long have you been doing this walk? I mean, it's about 2 hours walk every day. She said, oh, I've just been doing it for the last 80 years. 80 years, my goodness me. But she looked great. She looked great. She actually said to me, you know, doctor, I feel as sexy today as I did when I was 90. I stayed quiet, you know. Exercise does much more than that. It manages our stress levels. Are there any people here who have stress? Goodness, I think all of us are suffering from stress at some stage. One of the quickest ways to manage your stress is to exercise. Now, you may not want to exercise. I tell you the truth, I don't enjoy exercising, but I do it because it's just like taking my medicine. I don't enjoy the process of exercising, but when I've finished, I feel so much better. If I have a problem and I go out for a walk, by the time I come back, the problem is still there, but I feel more equipped to deal with it. And we know that just by exercising for an hour every single day, it is more effective for medication for somebody who is stressed or depressed than any drug we have. So just make sure you get out there. Don't say to yourself, oh, I don't have time, you know, I've got a full-time job, I've got children to look after. You have to make time for yourself. That is an investment that cannot fail. It strengthens our bones. You know, the best way, there's lots of research being done on bone density, for example. You know, the denser your bones, the less likely you are to have fractures. There are two things that can really help you strengthen your bones. The first thing is not to have so many or such high proportion of animal protein. Those big proteins, when they get into your blood, they actually leach out the amount of calcium from your bones. Big proteins, they act as buffers. Those proteins like to attract ions, and they leach out calcium from your bones. You say, well, but all my doctors tell me to eat meat, cheese, dairy products to make my bones strong. There is no evidence for that whatsoever. The truth is, and you look this up, there's a Bantu tribe in Africa, the Bantu tribe in Africa. They do not have any animal products. They live up into their hundreds, hardly any hip fractures at all. The civilization that has the most amount of animal products in their diet are the Eskimos, the Inuit. They start having hip fractures at the age of 40. So animal proteins, animal products do not strengthen bones. Actually, they leach bones. The best thing you can do to strengthen your bones is to get out and walk on them every single day. That intermittent pressure you're putting on your skeletal system makes your bones stronger. Okay? There is nothing better than that. Obviously, if you can get out in the sun, that makes your bones even stronger. You make the vitamin D. But if you can't, if we're living in Britain, take some vitamin D3 supplements. So make sure you exercise at least 60 minutes every single day. And you know what? Exercise can be fun. Exercise can be fun. I mean, maybe you don't live in a place like this, but you can make it interesting for yourself. It doesn't matter how old you may be. You can always find a way to exercise. But make it something that you're prepared to do every day. And if you're prepared to do it every day, it has to be fun, right? And I've already contradicted myself and said I don't enjoy it myself. But most people, and I have to say I'm one of the rare people, because most people, when they exercise, they'll say, oh, for the first month we found it difficult, but after that, yeah, I couldn't live without it. Some people can even get addicted to exercise. What are the actual side effects of exercise? It's a drug. So what are the side effects? The side effects are you look better. That's a side effect. You look better. You know? You feel better. Honestly, sometimes when I'm getting a bit stressed myself, people can tell. They say, have you been exercising recently? I say, yeah, well, I've been off it for about the last week or so. They say, yeah, go out for a walk, Chidi, because I'm feeling a little bit tetchy. Things start to get to me. You feel better every time you exercise. Can you overdose on exercise? Yes, you can. You can overdose. Overdose can mean injuries when you're completely repeating strain on certain ligaments and certain joints. So you do have to be careful. But that's why I always say, make sure that the exercise that you're doing is pleasurable, not too strenuous. Walking is fantastic, by the way. Anybody like to walk? Anybody like to dance? Oh, I caught you out. You like dancing. Okay, good. Good. No, but dancing is one of the best exercises you can do. You know that. Because it's pleasurable, you're happy, you're moving all sorts of limbs. It is very good for you. Maybe I'll get told off after this, I don't know. So I'm going to take you back to this gentleman, Thomas Edison, inventor of the light bulb. This is what he had to say about the future doctor. The doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and the cause and prevention of disease. That was way back in the 1800s. He was looking forward into the future, saying, that's what the world needs from doctors. That's what the world needs from medicine. So today, I'm just giving you this prescription of diet and exercise. Those of you who can't find a doctor who can prescribe this, just do it yourself. Use your diet, use your exercise yourself. Okay, now, we have a few minutes. I can take some questions if you have any. Any questions? I think they'll need some microphones if they... So put your hand up or stand up and...
Hello? Yeah. I want to know, why are the doctors so upset with us when we talk about health, when we talk about having garlic instead of taking their antibiotics? They get very angry. They literally get angry with you when you talk about, when you go to the hospital and you say, yeah, I do this and I eat raw food. And they're like, I went to a hospital once, I was being wrong with my diet and my iron was very, very low. And I said I didn't want the blood transfusion. And they had me sitting in the hospital for 2 days without giving me the iron, the drip. Mm-hmm. And they just got very, very angry with me. And I wonder why they always do that.
Okay, well, I'm sorry that they get actually angry with you. That should never happen. But you have to have a bit of sympathy with some doctors. I remember when I was a GP, there were certain patients who would come in, they'd have a certain illness and they'd have a stack of papers and they'd pile them down on my desk and say, Doctor, I've been researching this, what do you think about it? And I'd say, I have no idea. I said, well, can you take this away and read it and then come back? All I'm saying is sometimes the patient knows a bit more than the doctor. Okay, that's true, because you've researched it and you know your body. They should never be angry, but often as medics, we were never taught in medical school, we were never taught about health and lifestyle. We never taught. We were hardly ever taught about nutrition. Even today, that's the case. So you have to be a little bit patient with them. And you know, if you have a doctor who's getting upset with you all the time, you can change your doctor. You can change your doctor. Look for a sympathetic doctor. There are more and more doctors now who are beginning to realize that what we do with our bodies, what we eat and how we exercise can affect us even more than the medication they give. So go and have a look for a decent doctor.
I remember last year hearing you say that somebody with high blood pressure shouldn't be doing exercise in a gym because it will higher the blood pressure at the start. What about swimming?
Yeah, so what I was saying is if you have high blood pressure, what you should never do is any very strenuous exercise. So no running hard or no weightlifting. But actually swimming, walking, gentle cycling is all very good. That just gets your heart rate going up a little bit, but not too much. Those sort of exercises are perfect for high blood pressure. Certainly if you've got a swimming pool in your back garden, use it, okay? Don't worry about it.
I just want to know what causes arthritis, and is it true that when you go to sunny countries, it gets better?
Okay. What causes arthritis? I think we've probably got lots of people in the audience who can actually verify the fact that, you know, if you have painful joints and you go to the Caribbean or you go to Africa, the painful joints get better, okay? And that is usually because rheumatoid arthritis is one of those autoimmune problems whereby the antibodies are attacking your joints. The one way to suppress those antibodies is to have high levels of vitamin D. When you go out into a sunny climate, you make lots of vitamin D and it suppresses the attack on your joints. And for many people with all of those autoimmune problems, it gets better in the sun. There are some exceptions, things like multiple sclerosis. If you're quite advanced, you find it very difficult to be out in the sun. But for most autoimmune problems, being out in the sun does actually help. And in fact, I think we showed last year that all the countries that are on the equator have very low levels of autoimmune problems. The further you go from the equator, the more arthritis, multiple sclerosis you get. In fact, Scotland has the highest level of multiple sclerosis on Earth. Great.
I have got two people that I know of, one with type 1 diabetes and one with type 2 diabetes. They've got ulcers which won't heal. What can you recommend?
Yes, so if you have, well, first of all, for the person with type 2 diabetes, as well as having all of the treatment, what you should also do is try to reverse the type 2 diabetes, getting your blood sugar levels low and normal. The more normal your blood sugar levels are, the less the bugs that affect ulcers will actually make it worse. So certainly do your dietary changes, but depending on the severity of the ulcer, you might need surgery, you might need all sorts of other treatment. But if you're type 2 especially, you should be looking to reverse the type 2 diabetes.
Good morning, Dr. Chidi, and thank you for your talk. My question is, what exercise would you recommend for someone with cervical spondylitis myelopathy?
Okay, that's a long one. That's a
Very long one. Three in one.
Okay, so spondylitis.
Yeah.
So your spine is a bit narrow and bent. Look, if you can't get up and walk an awful lot, just like they do in some of the elderly homes, get up, get 2 tins of baked beans and lift them above your head. Anything that can get your heart rolling. I see lots of people going to the gym who are unable to walk at all. So they come in their wheelchair, and there's lots of things that they can do to get their arms moving. Anything that can raise your heart rate a little bit is good exercise and gives you a good benefit.
Okay. And it won't damage your spine further?
No.
Okay.
That sort of gentle exercise doesn't damage your spine.
Thank you, very kind.
Okay, you're welcome. I think I'll take one more. I think our time is just about up. I don't know. Okay, we don't want to riot. Okay, there's someone at the front here.
I'm asking, is there a time that you can exercise, that is in the night or in the day.
Or is there a better time to exercise?
Yeah.
Yeah. Okay. I personally, for example, if I go away on holiday, I like to exercise in the heat of the day. Now, I'll tell you why. Because, if you're by the sea in your swimming trunks, just in your swimming trunks, you're getting all that sun all over your body. Okay? I know people try and shy away from the sun, but at least for half an hour or so, just to be out exercising, getting all those sun rays on your body is good. So you're doing exercise, you're also getting the dose of vitamin D at the same time. However, lots of people, you don't like to be out. I mean, if you're in London, living in London, you're not going to be getting so much vitamin D. If you want to go in the evening, that's okay, but the problem is, it gets your heart rate going, you become more alert. So if you're going to go to sleep in the next few hours, you're going to find it more difficult to go to sleep. A better time is in the morning, okay? So even before work. So you start your day, you get out, go for your walk or do your exercise, then go to work. By the end of the day, you're quite tired and you get a much better sleep. Okay, well, thank you very much. I will be back, I believe, on Friday. Until then, have a happy, healthy day.